Yes, we've got Parliament. Thank you. Thanks. Oh, good morning, Queensland. Can I advise this morning that there is 0 new community cases. We have 1 new case that is overseas acquired and in hotel quarantine. That brings us to 17 active cases in Queensland, and I want to thank Queenslanders. We had 10,103 tests in the last 24 hours, so thank you, Queenslanders, for continuing to come out and get tested when you have symptoms, and that is still so critical that if you have any symptoms anywhere in Queensland, you come out and get tested straight away and you isolate yourself until you get those results. We had 13,603 vaccinations in our public health facilities. And overall, we've now hit 75.68% first doses and 61.22% second doses. So keep coming out, Queenslanders, getting your vaccinations. If you are due for your second dose, come out and get your vaccination when that is due at any one of our many clinics, and of course at your GP or your community pharmacy, and of course at pop-up clinics like the one behind us at QUT here. You can walk past, get your jab, head off to uni, or if you're in town doing shopping or for work, you can pop along to one of our clinics, including our mass vaccination centre at the Convention Centre, and get your jab today. So please don't wait. People, the date of 17th of December is coming around very quickly. We need people to get fully protected, which means you need to be out getting your first dose this week. So don't wait. Come out today, tomorrow, over the weekend, and make sure you're getting your vaccination.
So no new community cases, which is excellent, particularly given we have had a few cases down at the Gold Coast now. But thank you very much to those people who live down that Gold Coast area who've been coming out over the last week. So I feel fairly comfortable that given that amount of testing and the fact that these cases have had very little exposure out in the community, we should be okay going forward. But we can't be complacent. It's really important that people just continue to get tested if they have any symptoms at all. Every single day we're seeing people coming into our state bringing the virus with them, whether they be freight drivers, whether they be people coming for other reasons. So we still need to, until our vaccination rates are just that bit higher, need to continue getting tested. Now we know that the big date is the 17th of December, when we will have significantly increased numbers of people crossing into our state, and there will be that increased risk. So the chance is now. This is our window to get fully vaccinated. So please, anyone who hasn't had their first dose, you need to do it this week. So that is with Pfizer at a GP or one of our clinics across the state. We've got so many of them, like this pop-up clinic behind me here at QUT, or Moderna. And there are a lot of pharmacies across the state delivering Moderna. So please make sure you come and get that first dose in the next couple of days. That's really important. 3 weeks later, get your second dose of Pfizer. 4 weeks later, get your second dose of Moderna. And that means 2 weeks after that, you have the maximum protection, which is really, really important. So make sure that happens. Then we've heard the discussion about booster shots. And the Prime Minister's just made an announcement, and I'll be talking with my colleagues at AHPPC on Thursday about the best way of rolling that out. So for people in Queensland, go and pull out your certificate and have a look when you had your second dose. Because for most people, it'll be 6 months after that that they need their third dose to really make sure they're protected. We've seen fantastic results from overseas for people who've had that third dose. Thank you.
Good morning, everyone. Can I just start with saying that everyone's very keen on what the roadmap says for how we're coming out of COVID in Queensland, and just to assure everyone that there is very detailed planning going against that roadmap at the moment and around what that will look like when we hit these dates and how we will be ready for that when we hit these dates in November and December and beyond that. And indeed, the planning is going so well that we are very confident that we'll be able to announce that well out as to what that will look like at our borders and how people expect things to operate. Can I just say, but in the interim, we remain under the current restrictions. It's very important that people still understand that we can still see outbreaks and there are still consequences for that. And we are still trying to make sure that we can manage that in the lead up to Queensland opening up. We saw 21,000 vehicles coming across our borders yesterday, primarily in the Gold Coast, and we are seeing people expecting to get in against what the future settings are. Please understand how you can come into this state and what you're required to do at the moment. This makes the jobs of our police incredibly hard when they're having to work through this, and indeed when they're getting pretty poor attitude from people who believe that they can come in. So please work with this. There are consequences for getting it wrong. Can I say also the home quarantine trial has gone extremely well. We're currently evaluating that and we are planning against an expansion of that going into the future. Those decisions have not yet been made. We will fill you in once we get to those. Other than that, can I just say to the community of Queensland, thank you so much for the past 20 months. Let's keep it going until we can get to the finish line with this. And the way you can help us, if you want to help your police to do this better, is get vaccinated. Get vaccinated and make sure you understand what your obligations are. Thank you. Yes, we have. No, we haven't. Sorry, Vane. Our investigation's at a point where the next thing we need to do is interview him. We are simply waiting for a health clearance so that we can do that. So once we're able to speak to him safely, we'll be doing so.
What do we know about the 17-year-old on the Gold Coast who got from a little hospital? Has that been?
Look, no, at the moment our role in that is assisting Queensland Health with contact tracing, so I'm happy to leave that to Dr. Young, but our role there is making sure that everyone that's identified that has been in contact with this young person is identified. My understanding is that person's safe where they are and is being cooperative. Thank you.
Yes, so he had a family member visit from northern New South Wales, from Tweed, and stay with them for 3 days. Last week, the 18th, 19th and 20th of October, and that person, when they went back to New South Wales, tested positive. So that's clearly where he's acquired it. That person who visited from New South Wales didn't go out and about in the community other than catch the 700 bus on a couple of days on the 19th and 20th of October. I don't know if there's a cluster there. I know about this case in Tweed who visited into the Gold Coast. So it's up to New South Wales who else has tested positive down there. I don't have those details. So essential workers can travel from the border zone into Queensland, and the definition of that is anyone who can't work from home. Kids can come to go to school. People can come to access healthcare, to access a vaccination, and of course to do essential shopping that they're not able to reasonably do locally in their own community. I don't know. So that's something that may or may not be looked into, but I'm, from a public health point of view, not concerned in that that person stayed there for a week ago, over a week ago, and we've had a lot of testing done in the Gold Coast since then, and we've not picked up any other cases, and they didn't leave the residence except to return back across the border a couple of times.
On the health mandate, how many workers are still unvaccinated, and will they lose their jobs come Monday?
Yep, so the Director-General of Queensland Health is working through that at the moment. As we don't have active virus spreading in our community at the moment, he's working that through very methodically with each hospital and health service to ensure it follows through.
Yesterday, Health told us the police weren't looking into that 17-year-old case, or police told us they hadn't been asked to look into it.
No.
Given the facts, though, shouldn't you ask the police to look into it?
Well, no, there's no concern with that 17-year-old. He lives here in... Yep, so we're getting more information from New South Wales to determine whether anything needs to be done in terms of looking at that person.
Relative who came into Queensland was infectious before he got tested. That's why the 17-year-old was
No, sorry, I wasn't clear. The 17-year-old has clearly got it from that person. That person only got tested when they went back to New South Wales, but they got tested soon after returning to New South Wales, and so they were in their infectious period while they were here in Queensland.
What's the Australian rules shutting out so many hundreds, if not thousands, of healthcare workers
How many health workers?
Well, if Queensland Health shuts out all these unvaccinated healthcare workers, will that put extra strain on the hospital?
No, we'll work that through. It's a very small percentage.
Vaccinations. Look, we make no apologies whatsoever for mandating vaccinations of our health workers and aged care. They are dealing with the most vulnerable people in our community. New South Wales has had people, even as recent as the last week, come into the hospital system and actually contract the virus while in a public hospital and then died from it. We have to do everything possible to reduce the risk of that. Also, which is why AHPPC made the recommendation they did, is that if we have unvaccinated health workers and the virus spreads through our hospitals, which it absolutely will, then we don't have a workforce. We don't have people who can man emergency departments and hospital beds and elective surgeries. We saw it with the Injapelli cluster when we had health workers having to go into isolation for 14 days because they were close contacts. We cannot afford to have large volumes of our health workforce off sick with the virus themselves and then potentially spreading that to patients and visitors. So we need a health workforce that is as protected as they possibly can be. And I know that David Crisafulli refuses to answer this question. The answer as far as the number of staff that may end up not working in our health system because they're unvaccinated is still far less than the number of staff that we would end up not having in the workplace if they were all unvaccinated. That is why this decision has been made, and you only need to look around the world. Over 110,000 health workers have died. Many have been sick with the virus, and it has put a massive pressure on the health system.
Are you disappointed there hasn't been 100% take-up within?
Oh, look, we always knew that there'd be some people. First of all, there are some people who are on long leave, so we're not worried about them because they're not due to come back from maternity leave or long service leave for a period of time. So we're not concerned about them because they know by the time they finish their leave, they're required to be vaccinated when they come back. But there is a small proportion out there who at this stage has made the decision not to be vaccinated. That is their right to do that, but it is a very small portion of a workforce that is more than 100,000 people, and I have full confidence that our hospitals will manage. Now, there will be pressures on the system, but those pressures are far less than what it would be if we had a major outbreak. And I don't understand why the Leader of the Opposition, David Crisafulli, refuses to back this in, why he can't give a yes-no answer whether he supports the mandate or not for health workers. We do have a breakdown, and I can say our doctors are almost 100%. They were very early on. We have very high rates across the nurses. Remember, when we talk about this, we're talking about cleaners. We're talking about people who work in the kitchens. We're talking about our wards person and our security staff. We're talking about the receptionists and admin staff. We're talking about doctors and nurses, physiotherapists, all of these people who work in a hospital system. So I'm very thrilled that we've got well over 90% already vaccinated. I think, we're at this stage, I think it's around 2,000 who have indicated that they're not vaccinated at this point. These people will be given a show cause come the 1st of November if they haven't got at least one dose, and we will work through this process. It's supported by the unions because they know this is about keeping our health work safe. We have an obligation to protect our workforce and to protect the public, and that's what we're doing.
We just had Minister local protein trial went extremely well. How quickly do you make a decision to bring those Queenslanders home who are still stuck in state?
Look, we have laid out our plan to reunite families. If people want that to happen quicker, it is in the hands of Queenslanders. If they come out and get vaccinated in large numbers now to get us to that 80% and 90% far quicker, then we can achieve that. I did hear an odd comment from the Prime Minister this morning saying we want to get that second dose 80% up. So if everyone came out now, we can hit that in a week. People can't come out earlier than what they're scheduled for a second dose. They must wait 3 or 4 weeks. It's shortly. So the board chair has indicated they're briefing the board, they're briefing the leadership team today, and also they will be briefing the staff. So it is their expectation. I've been advised the board chair will release the report and the implementation plan for any recommendations within a week.
Now, just to clarify, the Prime Minister's...
Just on the
Sorry?
border bubble, we've got this case that's come from Tweed. Obviously, there's cases just across the border. Are we sort of past the stage of closing the border bubble? Have you kind of accepted that there were cases within the bubble now?
No, we keep a very close eye on what's going on, and they've not had big outbreaks in any of those border zone LGAs. So we'll keep on looking. Well, when they've got sustained transmission, which is unlikely now because they're getting increasing vaccination rates in the border zone.
What would it take for a lockdown at this point? I mean, we've seen multiple cases, infections in the community, albeit limited, but what's your new threshold for when you lockdown?
A lockdown here in Queensland is becoming less and less likely each day, and the more people who get vaccinated, the even less likely it will be. So that's the most important thing. Here it's less likely in Brisbane because our rates are quite a bit higher. I've still got some concerns across the rest of the state where we've only got vaccination rates of about 50%, where lockdowns are still possible.
The government's saying we have 4 days to go for everyone to get vaccinated. Can you just explain the maths to me? Because it doesn't quite add up. I thought that we might still have another week to go before we've reached that sort of full threshold.
Right, so it takes, from when you have that very first dose, it takes either 3 or 4 weeks, depending whether you choose to have Pfizer or Moderna, and then it takes another 2 weeks after that. So to have everyone fully vaccinated by mid-December, they've really got to go and get that first dose this week. That's my absolute plea with every single Queenslander, 12 years of age and over.
The Prime Minister's just confirmed that the ban on Australian citizens travelling overseas without an exemption will be lifted on November 1. What's that mean for fully vaccinated Queenslanders?
Well, my understanding is that you've got to have 2 doses of vaccine to travel overseas.
And what about
So
when
that's
they
good.
I guess when they return?
Well, it will depend where we're at, whether we're at 70, 80 or 90% vaccination as to what happens when those people return.
And on the roadmap, after 90%, does that cater for international tourists coming in, or is it just returning Australians?
Yep.
What's the...
No, it's very clear in the roadmap.
So it is for tourists.
Yep, the roadmap is very, very clear. Yep. So we need everyone to reach those thresholds, and if we reach them earlier, the Premier has clearly said we'll introduce those new processes earlier. So there's a challenge to every Queenslander, and why we should absolutely push this week and see if we can reach those thresholds earlier. Thank you.
Thanks, everyone.
Whose is this? Oh, right.